One of the things that I'm really passionate about is pain control in our veterinary dental patients.
Certainly, me too, all the way.
I believe really strongly in doing nerve blocks on every extraction, even those little simple, what we call plucker extractions, kind of one little finger out. Even if you're doing any deep root planing, things like that, we need to do pain management for those patients. It hurts.
Certainly it hurts. And I think often these times, or these patients are coming in and we're doing multiple extractions on them. They've never had dentistry before, and they often are, the 12-year-old Yorkie that comes in and needs 24 teeth extracted, and that's painful. So I know that at our practice we do a lot of different levels of pain management, and I know that you do personally a lot of pain management in the form of local blocks.
Local blocks as well as multimodal pain medicine, from pre-anesthetic pain management all the way through discharge and take-home medication for that patient to make them comfortable through the entire experience.
We do that at our practice as well, from preemptive pain management, which is so important to control the pain before we even create the pain.
Correct.
And then intraoperatively between local blocks and multimodal constant rate infusions and the to-go-home medicines as well. It's really important that their to-go-home medications are multimodal as well. An NSAID plus an opioid. Sometimes even if they stay in the hospital and are on continuous injections, if the owner can't give the medication. I think that's a big thing too, is talking to the owner and finding out, can you give this pain medication post-procedure? And if not, how can we work together to find a medication that's going to work best for your pet so that it ensures that they do get that pain control that they need?
Yes, and you're right, hospitalization could be the best option for some patients.
Yes.
And we don't do a cookie cutter approach where everybody goes home on the same 2 drugs. It really is based upon their blood work, what their owners are able to do, what the animal can handle as far as pain management. But I think the greatest joy for me is when I have the owners come back at their 2-week checkup and they're talking to me that they didn't even realize, they would have never noticed anything had happened to their pet, because all of a sudden, they didn't act like they were painful at all during the entire procedure.
Right, but now they're playing with toys that they never played with before, and they're eating much better than they did before.
Correct. I actually had one gentleman who had adopted a puppy, and we took care of it, got it cleaned up and sent home, and he asked me to actually put the teeth back. He thought I had adopted a really mellow little dog, and now I have this crazy dog, and I'm like, that's what they're supposed to be like.
Yeah, that's that's being pain-free, and that's what we want. And I think another thing, when you're looking at multimodal pain management, another aspect that's so important is really that you have a team approach to it, especially with the dentistry patient, because one technician can't do everything.
No.
So at our practice, we believe strongly that whoever's doing the dentistry is not in charge of the anesthesia and pain management, and we have a dedicated anesthetist for each dentistry patient, like you would for a surgery patient.
I think that is very, very important, because when I'm doing a dental procedure, I am not able to really concentrate on what the rest of that animal is doing. I'm concentrating strictly on the oral cavity. And I could have a monitor going, but I can't keep my eyes on it and keep the patient going and get the dental procedure done in a good period of time. So.
Right. And in anesthesia, it's so important not only to use your monitors are great, but also your eyes, your ears, your hands, your stethoscope is one of the most important monitors. So if you're busy doing dentistry, you don't have that hands-on. You can't be feeling pulses. You can't be listening to the chest and looking at all of those physical parameters that you can touch and feel. And I think when you have a technician who's dedicated to the anesthesia and pain management, while you're focused on the teeth, they can come in and adjust a CRI if needed, or add in more opioid if needed, if the patient's reacting under anesthesia.
I think too, it's we have to realize that many times our dental patients are the patients that are at higher risk.
Certainly.
Because we've either not been as good as getting them in on preventative care, so they are at a greater risk than many of the other patients we see in surgery. So we have to be sure we're monitoring them throughout the entire procedure.
And providing really, really good pain control.
Yes.
From start to finish.
From start to finish.
That's really, really important.
Avoid wind-up and take it all the way through till the animal is healed at home.
That's right.
Meow.